Balthazar is the quintessential American. He's an immigrant and an entrepreneur. He came to Los Angeles from Mexico, where he was born, when he was just 14 years old, and he went to work as a gardener. In his early 20s, he took a risk. He started his own gardening company, and today it employs 8 people. No one is making a whole lot of money. They're working 8 hours a day, every day of the week. His workers make around $17,000 a year. A few years ago, Balthazar looked into buying his workers health insurance. He wanted to be a responsible employer. He says, before Obamacare, all insurance is expensive, like $500 per month for each worker. That was unaffordable. He couldn't pay for $500 per month for each of his workers, who were only making $17,000 a year. In some way, Balthazar's dilemma is classic. A small business, relatively low-wage workers who are young, and yet they can't find affordable health care insurance. And Balthazar's employees are classic. They're working hard, and they're uninsured. Over the years, Balthazar's brothers and workers have needed some health care, even though they're uninsured. A few years ago, one of the workers cut his finger. They took him to a general hospital in downtown Los Angeles. He received about 7 or 8 stitches, and the bill came to $1,800. $200 per stitch. Balthazar had to pay cash for that problem. A few years later, his younger brother developed appendicitis and went to the UCLA emergency room in dire pain. The appendectomy cost in excess of $25,000. They didn't have that kind of money. His brother has been repaying the hospital $400 in cash each month. It took him more than 5 years to pay off that bill, and it was more than a year of his salary. And most recently, in July 2013, Balthazar was vacationing in Mexico when suddenly he felt crushing chest pain. My heart started pumping real hard. Someone was crushing my heart. Well, for any doctor, that sounds like a heart attack. Balthazar drove straight to a Mexican hospital where the doctors determined he had a blocked coronary artery. Fortunately, he didn't end up with a heart attack. But the pain was just a warning to him. Having a blocked artery at 30 years old is very serious, suggesting high cholesterol and probably high blood pressure to boot. Balthazar said, "Since I came to this country, I haven't been to the doctor. I haven't had a checkup. I always worked fine, but I am sick now, and now I have to take medicine, and I have to see a doctor every 6 months. I now know all my workers have to have health insurance." Throughout the summer and fall of 2013, Balthazar saw a bunch of commercials for health insurance, but he says he won't shop on the internet. It's creepy. He thinks it's unreliable. Balthazar is classic case of an American who's trapped in an uninsured situation. What Balthazar knows is that his workers need health insurance, but that he can't afford the $500 a month for each one of them, given their low wages. Balthazar's case reminds us that illness and injury can strike any of us unpredictably, and that we all need healthcare services at some point. It also reminds us that the healthcare system is expensive, complex, and difficult to navigate. This course is going to go over the operations of the United States healthcare system. We're going to review the history of the healthcare system, the history of hospitals, physicians, as well as health insurance. We're going to try to understand how they came to be what they are. Then we're going to review healthcare financing and health insurance, explore the rationale behind insurance and the problems that health insurance creates. We're going to clarify all that complex language of insurance, deductibles, co-pays, co-insurance, risk pools. Finally, we're going to explore all the different groups that actually provide health care to Americans. We're going to focus on hospitals, doctors, and nurses, but we also have to look at the drug and device manufacturers, regulatory bodies such as the FDA, and regulatory bodies that make sure all doctors are qualified. We're going to try to understand the different components of the healthcare system, why they exist, where they came from, and it'll set you up to understand the complexities of reforming that system. So this course is meant to help you understand the complex American healthcare system and lay a framework and foundation so you can understand the nature of the reforms in the Affordable Care Act and what their likely effects are going to be. So let's begin with the history of healthcare, where we got our hospitals from, how doctors have evolved from being snake oil salesmen to the most respected members of the community.